Welcome to another podcast of Immunity Group Australia on Spotify and Apple Podcasts. We have an amazing guest today. I'm so excited to finally meet Thomas Silvera
Yes, yes,
from Pennsylvania, USA. Um,
yes.
I followed Thomas's foundation's work for over a year now, and it's the most inspiring work I have probably come across in this whole food allergy space. Thomas is a co-founder of a foundation, Elijah-Alavi Foundation, due to a tragic loss of his son, and he can tell us more about that. And they have been trailblazers in the food allergy community on a legislative level, on the political level. And this is really a role model for Australians, I think, to follow. Thomas, welcome to our podcast.
Yeah, thank you for having me. I know it's definitely been long overdue, but we're finally here. We're talking, and we're going to talk about some important things that, especially that impacts the food allergy community. And a little bit about myself. I'm Thomas Silvera, co-founder and vice president of the Elijah-Alavi Foundation. We started the organization due to the tragic loss of my son on November 3rd, 2017. He was at his New York City child care center. As parents, we make sure that we want to provide a safe space for our kids. So unfortunately, he had come to his demise on November 3rd, and now we're here. We're I'm in a space that I know a lot of parents don't want to be, but it's a way for us to create awareness and be the change that, as I quote, be the change that the world wants to see. So
And you certainly are. I have to ask you though, how did you overcome that grief stage to become an activist? Because a lot of tragic cases we had in Australia, and usually in Australia, we don't even hear about it ever again.
yeah,
In the
yeah.
UK and in the US, it's been the opposite. So, how did you, as a parent, overcome that stage to become the global activist, really?
It it's interesting because I never wanted to do any of this, you know? The reason for me to do it, even in this grief, is that I needed to forge a path for my son Elijah that was taken from him. So even with my other son, Sebastian, I needed to forge a path for him to see that through tragedy and adversity, you can overcome a lot. So, like I said, I didn't want to be in this space. So I had literally had to kind of like pull myself out of my own body in order for me to see a way where I can make a difference. And and I'm still grieving. And it will never go away, of course. But I think this has been my therapy. It's a way for me to continue talking about it as I'm grieving still through the process, even 6 years, or it can be 20 years, or how many years from now. But it allows me to talk about it where I can share my experience and create the impact and give a platform for those who don't know and those who do know how to advocate, how to create the awareness, and so forth. So like I said, it's a struggle day by day, but there's a meaningful impact behind what I do and behind what me and my ex-wife do on a day-to-day basis. We have to continue forging a path and a way for everyone who has never been there, in which we can also avert people from ever being in our space as well.
When you established your foundation, I mean, I feel this is like you've been the light which has lit up a lot of people around you in that space and globally. How difficult was to start a foundation, and did you have any support?
Oh, wow. It was one of the most challenging things to even start. Is you look at it on a scale and you be like, what is the beneficial factor from starting a non-for-profit? A lot of people they start organizations just because, but we are not starting an organization just because we're starting it for a cause. And it was hard to do that, to even fathom of doing something like that, because of my child had passed. I was like, I don't want to do this, and the support I had, my cousin who was there from like the day one, Ruben, he's our COO of the organization. And he was like, he's like, you ever seen that organization, Mom Against Drunk Driving? I think it was like MAD. He was like, he's like, that's what I see this organization kind of like embodying to. He's like, because it's like, she had suffered such a tragic loss through her child being, killed by drunk driving, and she took that energy that she had, instead of utilizing that anger, she put it into something more tangible, which you can actually physically see the work just transform. And it creates such, like, oh my god, it's like the ripple effect where she's creating change and changing things, not just in the simple thing, but you're changing policies, you're changing people's mindsets and how things are done on a regulatory scale when it comes to legislation and how they do things in every state. I didn't see myself in that position at that first moment starting a non-for-profit. The logistics of it's pretty simple, but it's how do you start to build from that day one? So once I started learning, I was calling everybody in the food allergy space, the media, you name it. I just needed to gain connections and for people to understand this is who we are, this is what we're trying to do, and how can we get from point one to point 1000 or so forth. So, and it's only in people think we have such a large, group of people that runs this organization. It's me, my ex-wife, and my cousin, and this is what we do. But we want to do and make sure it doesn't matter how small an organization is or how large you are. Is like, what are you creating behind every door that you're opening? You want to create something meaningful and impactful.
Wow, what a story. What a beginning.
Yeah. Hmm.
In terms of Elijah's Law, I would
Yeah.
like to tell us about it and tell our listeners about that.
Yeah. Elijah's always was quite interesting because one again, it wasn't something we wanted to do. Um, Elijah's mom, Dina, even in her grief, she did so much research, like probably like weeks on out, even like suffering through her mental state. And like I said, mental health is such a big factor in every single thing we're doing, even right now as we're speaking. She went through that and she did her research within the New York City childcare system and found that there was no legislation that actually protected children in childcare centered in New York. Baffling, because if you have a legislation for K through 12 to have like a voluntary guideline within those school system, why would you leave out the most vulnerable? So we both did our due diligence. She was the researcher, and we reached out to our local legislators, um, and say, "Hey, we need something like this, and how can you help?" Unbeknownst to them, they had no idea what food allergies were. We were the educators for them. So we're talking about a senator, we're talking about an assembly person. Um, they had no idea. So we educated them. We worked with an organization at the time. The first round of Elijah's Law in New York State, we worked on that and we had written a certain piece of the legislation. It went through in 2018, but it didn't pass both the Assembly or Senate. It just went through the Senate, and it was kind of unsettling for us because it negated the literal language that we wanted within that legislation. So it kind of like put us in a little bad taste in our mouth. So, but we went right back at it in 2019. No, late 2018, after it passed that summer. But in 2018, late that 2018, we were able to work with the same legislators again, writing a whole new component for that bill,
Wow.
scrapping everything, writing a whole new component, and then watching it just go through the legislative process seamlessly with very small oppositions dealing with financial factors, but we were able to fine tune it by removing certain aspects of the legislation where it just unanimously kept passing through. And then seeing it through, and then it passed both the Senate and the Assembly, and then like hoping that it would be signed by the governor. And it was one of the things when you get that call later in the beginning of like September from the senator, it was like, hey, the governor has your bill, he's going to sign it. That was
Wow.
one of the most emotional moments for us. And I talk about it now and I'm getting emotional because that was the step for us to continue creating change. So it passed, it was signed by the governor. It was the very first bill ever in New York State forever to happen and for childcare centers, and the very first in the nation. So that has us sitting up now. It was like, okay, but we did it here. Let's look into every other state and see what we can do there. And that's what we've been doing.
Wow. I mean, for someone who I spent about 8 years in federal parliament in Australia. I know how difficult it is to do what
Yeah.
you've done.
Yeah.
Working behind the scenes, changing, modifying. it takes a lot of effort, but it also takes a lot of support and legislative knowledge. And I guess you would have also reached out to the right people at the right
Yeah.
time.
We reached out to a phenomenal group of people. Like I had no idea how to move the legislative process. I'm not keen in policies. I'm not familiar with any of that. I had to learn along the way. Hence, where I'm at right now is like learning so much. It had propelled me into this direction. So working with organizations like AFA, Asthma and Allergy Network, FACT, FAIR, everybody coming together on that same platform and being on a unified front because we all want that same thing to happen. We want to put legislation in place to save lives, to give peace to everyone who deals, whether it's asthma or food allergies or anything that can affect a human being. This is what we need to do in a unified front: is come together and create that change. And and till this day, I'm still grateful for everyone being an instrumental part of why Elijah's Law exists, you know, outside of it being the namesake of my son. Elijah's Law exists because everybody cared, everybody wanted change, and this is what we did.
And the change was definitely long overdue and to prevent
Yes.
tragedies. What about
Yeah.
the actual industry? Did you find any resistance in the industry? How did that part play out?
So when creating the bill, we a lot of the resistance is dealing with more of the financial aspects when it comes to the legislative process. It's like, who's basically paying for this? Is it a state? Is it federal? Is it local? It's so many aspects that goes into it. So when you can identify, we were able to identify a specific grant specifically for childcare, that can allot funding for that, specifically for food allergy training and epinephrine access. So New York was the very first to actually get a hold of that grant and actually allocated $20 million specifically for Elijah's Law in New York State, where they're able to get training, they're able to get epinephrine access. We're talking about $20 million for specifically for this bill because food allergies is on the rise, and now our legislators are now seeing the importance of, okay, we need to start now. We need to start making changes now. And I think the catalyst of that was the passing of Elijah's Law, which is so unfortunate of my son passing, for people to actually see something like, oh my God, that's, you can say it's like on the system in a sense, you know? So when there's a broken system, the way to fix it, and it's not the legislators, they can do it themselves, but it takes the people to do the fixing. See the crack, provide the foundation where you can fix it. So the oppositions is more on the financial aspects, and sometimes the legislators won't agree with certain aspects. And dealing with the childcare entities, whether it's unionized and so forth, or Department of Children and Family Services, the Department of Health, it's like trying to get everyone to agree on the same thing. And we deal with a lot of oppositions with that, and because every state is governed differently. New York, thank goodness they moved the way they did, and the other states that had passed Elijah's Law seamlessly, but other states still have these oppositions where the communication aspects kind of like lack, not on the legislative, not on the bill, but it's on the entities that govern it, whether it's the unions for the childcare educators or whoever it may be. The communication is like, okay, we need to have this, everyone to understand that, hey, we're on the same page. We're just trying to save a life.
And how many states have passed Elijah's Law now?
Oh my gosh. Okay, so New York, Illinois, Virginia, um, Maryland was just recently signed. We have a city ordinance in Kansas City. So it's an Elijah's Law city ordinance in Kansas City. And then we have a component of Elijah's Law in Connecticut. So give or take about six. So, and then we currently have bills in Pennsylvania, California. It's actually moved through the Senate right now, so we're waiting for communication to be clear in California. That's going to be pretty huge because we're talking about so many individuals, so many young children in there that will be affected and be saved by that bill. We currently have a bill in Pennsylvania, but six on the process that has been like pretty much passed, but then on the horizon, it's like we're not stopping. So we have multiple bills that I think it's California, Pennsylvania, Michigan. We're reintroducing Missouri again this year, reintroducing Kansas City again for the actual bill, not the ordinance. And then we have a city ordinance moving in New York City for Elijah's Law. So yeah, I say it's keeping us busy, but it has to be done. It has to be done. And I want to point out AFA, we work together on a toolkit. If you go to the Elijah-Alavi Foundation.org or AFFA.org/Elijah's Law, there's a toolkit that actually is provided to anyone who wants to get Elijah's Law in their state. Our organization and AFA worked together to create this toolkit and looked at every state to see what was missing in the childcare sector. And what we do, we go into those states and we go to enact Elijah's Law and close the gap for whatever's missing.
That's amazing. Could you see
Yeah.
that perhaps spilling across the border to Canada?
Um, I want to see something like this not just in Canada, everywhere, whether it's Elijah's Law, whether it's someone else putting the bill forward. It's like the namesake is a legacy for us to keep, but the impact of the legislation needs to be profound to save lives. And that if whether it's a name that's tagged to it or it's just a legislation bill that's going to keep someone safe. And that's how I see it. But in Canada, yes, let's go to Canada. Wherever we can take this bill to save lives, it will be important.
I love the fact recently I've ordered new EpiPen kits for my children, and I
Oh
found
wow.
inside Elijah-Alavi Foundation
Yeah.
work. Tell us about your
Yeah.
partners. I mean, that was very nice.
Wow.
The kits were the most beautiful kits I've ever seen as well.
Yeah, yeah, no, oh my God. It's Stuart and Ann and Sam and Lily, like they're an amazing family. We reached out to them because I ordered the EpiPen case from Amazon and then I saw what they did because my son Sebastian was in school and he needed it for his health para. So he had a health para with him every day because of his food allergies. My other son has multiple food allergies. He grew out of eggs, which is phenomenal,
Huge.
but he's still allergic. He was still at the time allergic to eggs, dairy, and peanuts. So I ordered a case, gave it to his health para to have with him all day. And I read about Pragmatic. And I was like, oh, let me write to them. I was like, hey, I love your case. You know, this is, and I told them my story, and they were very empathetic to what I was telling them and everything. And we worked together to create they never had a teal case. Don't quote me that, but I believe they never had a teal case. And they created the teal case in honor of Elijah. And, it was one of the most like I think one of those they were one of our first partners ever, and we're still partners with them today. I owe them a great deal. Like I love them. If I ever go to to Sydney or whatever, I would want to meet them. I'll meet you, everybody who's over there. But they've been phenomenal since day one, and they still are to today. I don't just call them partners. I call them friends. Everyone that we partner with, we all have that same mission. That same mindset, and you become not just partners or colleagues, you become friends because it's a family thing. This food allergies is, this it seems so niche, but it's on a more grander scale. It's a global scale that there's so many people affected by it, but not many people talk about it. But having partners like them is phenomenal. And I love that they still have, Elijah's information in there, which creates that memory that continued lives on. And it shares that story for other people to know that, wow, this is how serious food allergies are, or this is such a great thing that's been done.
And we personally love it as well, and would encourage
Yeah.
everyone to support that
Yeah,
one.
no, absolutely. Absolutely. Yeah.
In Australia, we are called the food allergy capital of the world.
Yes.
Often Australians are overdiagnosed and undertreated as well. But it's the fact that food allergies are on the rise, especially second generation, third generation migrants have even more cases. We don't know exactly why that is the case, but it's a
Yeah.
fact in Australia. So we do hope that sort of your role modeling will transcend the oceans and
You, you,
also
you,
anchor itself here.
Yeah, no, absolutely. If I can be a role model to transcend, across the globe and share what we've done here on a global scale with everyone, it's more than I can ever imagine, and I would love to see that. We know that food allergies is on a rise everywhere. We don't know the actual finding. There's so much research that points different direction of how it's transpired, how is, from you name it, what medications are being used, what medications are being FDA approved to actually help mitigate risk. There is no known cure, but there is a lot of research that seems very promising out there that gives hope. We talk about the Neffy spray. That gives hope for people who are afraid of using needles. And having that FDA approved, especially here in the U.S., it's like gives almost a sense of a breath of fresh air. And we talk about other medications like one of my other favorite is the Advocacy because it talks. It's like having an AED in your pocket. Those are one of the things that actually gives a little peace of mind when I do my food allergy training in schools or communities. Everybody's like so like immersed and baffled that this thing can actually talk. Like, oh my God. But it also gives them a sense of peace because it guides you and how to use it. So when you have auto injectors or medication out there that can give people peace, until there's life-saving emergency service that can help them, it's great. So it's one of those things I think about when I think about OIT and slit and everything else. And I remember the old adage, especially is like with your parents and your grandparents who have done that. It's one of the things is like, you feeding your child these things in an uncontrolled environment. And it was like, no, keep feeding them that, and then eventually they'll grow out of it. But that was the old adage of how things were done before it was in a controlled environment in spaces where you're monitored and in the event of an anaphylactic reaction, you have a medical personnel that's there that could administer epinephrine and keep you safe. So, and I love that it is that pathway to, it's not a cure, but it will help you. It will definitely help you.
And I love the fact that America really is the global leader, thanks to people like yourself and innovators, because it seems that in America, that spirit of can do,
Yeah,
if it's
yeah,
broken,
yeah,
let's
yeah,
fix it. That
yeah.
attitude is often lost with red tape in lots of countries, from Europe to Australia.
Yeah, it's interesting. I the political how things are done in terms of regulatory system within on the global and the US and everything. I wish I knew a lot more. I don't know that much, but I understand like a lot of the red tape that goes into it and how the US does things opposed to any other global country that also does things when it comes to like being that can too and be like, oh no, if you're over here, no, no, we can't do this, we can't do this. But in the US, you can push that through. And there's so many people that want to, they are adding new innovation and new research into the food allergy community that is going to provide great hope for the future.
And what's next for the foundation? What's your sort of 18 to 24-month plan?
Oh my gosh. So the goal is like so right now we're looking into grants, right? We're looking into research grants. We just started our first research. We did a project working with Indiana University for Dr. Butte in Indiana University, putting our first research together for the foundation, which is great. So we want to do a lot of patient perspective research opposed to on the biologics or any medicine or things like that, because we want more of that information out there for the community so they can see that. So research is one of them where we want to build onto that. Um, we also want to build more partnerships. We are so underfunded. It's like if we do a lot because we are grateful for the community that we work with, but we're so underfunded. Like we run on I call it the shoestring budget for everything. So we have to really be mindful how we do things. And is to build partnership, to build, to get more grants for research, to build and to travel more, to go to other states and to teach more about what we're doing. And there's a lot of us that are doing that, but there are still empty spaces. The room is can fill everyone who wants to be a part of it. And the next goal is to have Elijah Law on a federal level. That's one of the important things that we're looking into 24-25 is building that and creating a more profound grassroots effort behind that.
I found it also interesting in the US, the food equity initiatives are quite prominent, and food allergies seem to affect minorities also in the US in a sometimes different way,
Yeah.
whether it's also because of asthma being higher in areas with poorer air quality. So, what's your take on that whole topic?
It's interesting you say that because that's basically my whole dissertation in my for my doctoral degree. It's basically the in-depth um you're looking into food allergy management, especially when it comes to the underserved community and the healthcare access to that. There's so much disparities in the food equity, like you have deserts as well, and trying to provide more food and healthy services and food allergy management within those communities. It's underserved. You're not getting the right resources because of socioeconomical factors. You have a lot of people in the community based on, like we talk about, the environmental, through the air, rodents, you name it, is all affecting them, whether it's asthma or food allergies. Financial aspects play a big key. Mental health aspects play a big key. You look at those ethical standards where a parent plays on whether to either get the medication for their child or buy food. It's like, how do you look into that? I know parents that will have one auto injector for two kids who have food allergies and split the auto injector, take one to that school, one to that school. But we all know we got to carry two. And not having safe foods in specific communities because you have what they call like the small little grocery stores, the supermarkets don't provide allergen safe foods. You don't. You have to go outside of your community, which costs money. The food costs more money. And the same thing trying to find a healthcare access. You can talk to your primary care physician, but your primary care physician is not the specialist. The specialist you have to go to, which sometimes if you have Medicaid, whatever insurance you have, or no insurance, it's going to become it's an out-of-pocket expense unless that specialist provides some type of service that they give this service to the community, but it's not relevant. It's one of those things that's not there for the communities. So it's always been like that. It's just more prominent that we're talking about it now. But I grew up in the late 70s and 80s, and I was affected by that, being having multiple food allergies and asthma myself. I was none of that information or resources given. It takes a lot to go into the community. And, we have a lot of organizations going into the community, but we still have to do so much more. I always said, don't just talk about it, be about it. It's like it's easy to throw money into research and get numbers, but it's better going into the community and showing change, showing that this is what we need to do. And that's one of the goals for our organization. It's like is to gain enough funding where we can go into so many communities as much as we can to provide the added resources, the documentation, wherever it is that they need. This is what we need to do, and we look forward to doing that.
I love that. Don't just talk about it, be about it. I think that could be the title of our podcast today.
Yeah, no, no, absolutely, and I quote that from an assemblyman Al Taylor, and that's what he told me when we started Elijah's Law. He was like, he said, for me, he's like, when I tell you I'm going to do it, I'm going to do it because my goal is like, don't just talk about it, be about it. And I use that as one of those, like those imprompts to kind of like get me going. So I was like, and every time I think about something, I was like, don't just talk about it, be about it. So, and like I said, I don't post a lot on social media because we do a lot behind the scenes. I like to post when we're doing something, but not too much because social media can take you away from all the other work. And I don't want to focus just on social media. I want to make sure that we're honing in on the importance of why we have this organization, not on just on the legislative aspects. So it's like, but who else can we kind of like help bridge the bridge where we can actually build into communities and so forth. So it takes a lot. It's a lot of work that goes into it.
It's a double full-time work per person, I think.
Absolutely. It is. It is.
What's the
Mhm.
situation in the US in terms of, if, I guess, hospitality, food allergy safety, and language barrier? Is that a thing?
Um, I, I'm probably not very versed in understanding, but just based off my understanding, when it comes to like the hospitality aspects, um, hospitality, restaurant industry, you name it, you get very high turnovers. You get, lack of understanding in terms of like, food safety and so forth. There are great organizations that go into these hospitality spaces and restaurants to give these food allergy training, but if you have high turnover rates and you have some people that are not paying attention or not believing, the consumers that they have these multiple food allergies, whether it's celiac or food allergies or alpha gal, whatever it may be, if those sectors don't take this as a severity of its importance, then you leave vulnerability to leave tragedy open wide for everyone. So I think language barrier is key, and the in-depth understanding and how for food safety and cross-contamination and so forth. It's not just in that sector, it's in so many, it's in the schools, it's in the restaurants, and you name it, it's everywhere, and that's why there's people like us that we're not just fighting because we're angry, we're fighting to create change because we need to have spaces to keep people alive. watch, just hearing about the young girl at Costa, I think it was, that and the tragic death of that's so heartbreaking. Again, it goes to these spaces. It's like even though they get these food training, some of them have food safety training, but they're not understanding the importance when a person tells them, I have a severe food allergy, I have celiac disease, I have this. If I was that person, I of course I would say, oh, I'll do it differently. But it again, it leaves open for vulnerability and tragedy to strike. And it's gonna take a lot of fighting to change that.
And we recently had the whole Disney case at the moment backing off on the lawsuit. I mean, that was quite an interesting.
Yeah. That was interesting. It was kind of harsh to see that Disney went that route based off of subscription. I think that was a very cowardly approach on them for them to be like, "Oh, you can't do X, Y, Z because you signed a subscription." So you negated the fact that a man just lost his wife due to an allergic reaction and passed away. You have no empathy for that. Like you just, it is what it is kind of attitude. That's not how a person lost their life due to something, um, someone at a restaurant not following the rules, not paying attention to their customer. And the woman had stated several times what she was allergic to. And that's one of my fears today. Like it's one of the things I fear with my other son when I take him out. If I take him to a restaurant, I'm bringing food with him because it's like I've already lost my son. I don't need to lose another one or have him have a reaction based off of someone's negligence. It is unfortunate that it has to happen to so many people to die due to someone's negligence. It's so unfortunate and it hurts me. And I see it shared through social media all the time and it hurts me. It's hard for me to share those as well because it's so triggering to me. I'm still affected by my son's death, but to continue seeing multiple deaths after death after death, those deaths are due to negligence. It's so unfortunate.
You're creating change, and that is what matters the most. And I hope that our listeners will be not only inspired by your talk, but actually prompted into action
Yeah,
to do something about it.
yeah, no, I hope that, it's like my goal is when I do things like this is someone to just whether they take it all in or they take a little bit of it, but are able to share the information with so many, because I don't do the talks just to talk about what I do. I do the talks because what we can do, and that's what it comes down to.
Thomas Silvera, thank you very much for this super inspirational talk.
I appreciate it. Thank you for having me, and I look forward to talking to you via outside of this platform.
Thank you so much.
You're welcome.